Hello and welcome. You're watching COVID 360. I'm Sneha Mordani. Well, this week has seen India achieve a significant milestone of crossing 2 crore 50 lakh vaccinations in a single day. In this episode of COVID 360, we tell you how India achieved this feat. We also tell you about, in just about 20 days from now, India could be hitting the 100 crore mark when it comes to vaccinations against COVID-19. Also on the show, all you need to know about boosters, combination vaccines, and how vaccine efficacy world over is getting reduced because of the lethal Delta variant. But first up, an exclusive report on how India now plans to go about hitting this 100 crore mark in the vaccination drive. Government sources have laid out the plan to India today on how they intend to build on the momentum of the vaccination drive in the country. 100 crore vaccinations. That is the target of the Indian government, and that could be reached in the first week of October. Government sources have told India today that at the current pace of vaccinations, India could be very well touching the 100 crore mark in 20 days. Government sources say that they prefer the 7th of October as the preferred date for marking 100 crore vaccinations in the country. The reason being, 7th of October marks 20 years of Prime Minister Narendra Modi in public office. He was, of course, serving as the Chief Minister of Gujarat before he became the Prime Minister in the year 2014. The month of October is expected to be a good month for the country in terms of vaccinations. Health Ministry sources have said 3 vaccines are in the 3rd stage of trials, and gradual rollout will add to India's capacity in a big way. The government has also strategized improving vaccinations in areas where cases are high. Sources have said that Kerala-Karnataka border, for example, will see improved vaccinations in the next few days. On the agenda, 100% vaccination. At least the first dose for poll-bound states of Uttar Pradesh, Goa and Uttarakhand. More so, by the end of September, 1 crore doses of Zydus Cadela's COVID-19 vaccine will be ready to be rolled out. Zydus Cadila Zycov-D is the world's first DNA vaccine against COVID-19 and can be administered to children between the age of 12 to 18 years. The government is also expecting to receive 20 crore doses of Covishield from the Serum Institute of India this month. Last month alone, the Serum Institute provided 19 crore doses of Covishield. As many as 3.5 crore doses of Covaxin from Bharat Biotech is also expected. Additional doses to replenish exhausted stocks in states is also very doable now. The Health Ministry says this was not the case earlier, when often the vaccination drive would be stopped because of unavailability of vaccines. Government sources have also said that as early as 23rd of September, there could be emergency use listing granted to homemade Covaxin, which will give India's first indigenous vaccine a much-needed boost. In New Delhi, Sneha Mordani for India Today. Well, the week gone by also saw the 71st birthday celebrations of Prime Minister Narendra Modi. This report does a relook at the year and a half gone by and the Prime Minister's performance as the head of government in handling the COVID crisis.
आप इस समय देश में जहां भी हैं, वहीं रहें। अभी के हालात को देखते हुए देश में ये लॉकडाउन 21 दिन का होगा।
The war on coronavirus declared by Prime Minister Narendra Modi in a nationally televised primetime address began with the 21-day nationwide lockdown aimed at stopping the spread of the invisible enemy the world knew little about. At the midnight hour, with 4 hours of notice, the country came to a grinding halt. The lockdown announced at a time when there were 555 cases of COVID-19 in the country, ultimately went beyond the planned 3 weeks. For a while, Prime Minister Modi's messaging seemed to have worked.
मास्क, 2 गज की दूरी, हैंड सैनिटाइजेशन की हमारा एकमात्र विकल्प है.
Citizens embraced the strict restrictions, from banging thalis and ringing bells on Janta curfew that worked as a preview to the main lockdown that followed, to lighting lamps to salute healthcare workers. The country followed the Prime Minister's words to a T. But then reality struck. With no money to earn, little food on offer, thousands of laborers marched on foot from cities to their homes. A scenario nobody accounted for. In the end, the world's most stringent lockdown turned out to be a mixed bag. While it did not stop the virus, it did give India valuable time to ramp up health infrastructure. The country was able to ensure sufficient supply of N95 masks and PPE kits, the only tools at our disposal then to fight this infection. When advanced countries like the United States and the United Kingdom were overwhelmed by the first and the second wave, India seemed to have contained this infection.
जिस देश में विश्व की 18% आबादी रहती हो, उस देश ने कोरोना पर प्रभावी नियंत्रण करके पूरी दुनिया को, मानवता को बड़ी त्रासदी से भी बचाया है.
India celebrated elections and festivals with equal abandon. The Prime Minister, who's often hailed for his messaging, was seen with huge crowds. For a while, COVID seemed a thing of the past. The declaration of victory proved premature. The virus struck with vengeance even as India lulled into complacency. The second wave swept an unprepared country in April and May. Hospital beds ran out, oxygen ran out, medicines ran out. Thousands lost their lives. In an editorial highly critical of the Indian government's handling of the coronavirus pandemic, the Lancet journal said India wasted its early successes in managing the pandemic.
कोरोना में लोग मरते रहे, ऑक्सीजन नहीं मिली, टोसिलाजोम डेक्सोना का रेमडेसिवियर का इंजेक्शन नहीं मिला, वेंटिलेटर का बेड नहीं मिला, अस्पताल में बिस्तर नहीं मिला, डॉक्टर और नर्स नहीं मिले. कौन जिम्मेवार है? मोदी जी ने राम भरोसे पूरे देश को छोड़ दिया, और लाखों लोग अगर मरे तो उसके लिए अगर कोई जिम्मेवार है तो वो मोदी जी स्वयं हैं.
The second wave was a jolt for the Narendra Modi government. It soon got down to course correction. The Prime Minister dropped Union Health Minister Dr. Harshvardhan on the 7th of July. The focus shifted to vaccines. The country has already seen the highest number of doses administered on the 17th of September, the birthday of Prime Minister Narendra Modi. India administered over 2 crore 50 lakh doses on this day alone.
The Prime Minister's vaccination program has been hailed as one of the most efficient and effective vaccination program across globe. The country is out of this crisis to a large extent, and our economy has now back to full path of recovery.
After the initial glitches, the Narendra Modi government has succeeded in ensuring a steady supply of vaccines, and the country has been able to do much of its own, producing them here. India today has 6 approved vaccines, and an antidote for children is likely soon.
भारत को वैक्सीन के लिए आज किसी और देश पर हमें निर्भर नहीं होना पड़ा. ये दुनिया का सबसे बड़ा वैक्सीनेशन प्रोग्राम हमारे देश में चल रहा है.
From January 2020, when the first COVID case was reported in India, Prime Minister Narendra Modi has been at the forefront of the fight against the virus, engaging with scientists, policymakers, vaccine manufacturers, state authorities and citizens at large.
In COVID pandemic in India, I think three most important things which were done right. Number one was ramping up testing. The best thing which was done was Make in India, particularly PPE kits. And third thing which was done was, most important, was vaccine research. We did our own vaccine and we had a good collaboration with the international community.
Rating the Prime Minister on his handling of the COVID-19 pandemic is no easy task. World over, it has been acknowledged that after the Second World War, this is the worst humanitarian crisis that the entire world, not just India, has seen. However, the World Health Organization has also acknowledged, and there is a sense now that India is much more better prepared to handle a third wave, if at all there is a third wave of the infection in the country. With Paulami Saha and Mosmi Singh in New Delhi, Sneha Mordani for India Today. World over, there is a raging debate on reduced efficacy of vaccines against the lethal deadly variant, the Delta variant. Well, this report tells you why and how vaccine efficacy is waning and what it means really right now for us.
A study on 614 fully vaccinated health workers in Bhubaneswar's ICMR Regional Medical Research Centre showed a significant drop in COVID antibodies 4 months after both doses. In this study, which was done around the time India witnessed a deadly Delta variant surge, 308 participants were given 2 doses of Covishield vaccine, 306 were given 2 doses of Covaxin. Among these 614 healthcare workers who were analysed, 81 were breakthrough cases. Among the 256 participants with previous history of COVID-19 infection, 33 were reinfected even after 2 doses of either vaccine. Antibody level for those who got Covaxin started to decrease significantly, and antibodies for Covishield recipients started waning significantly after 6 months from the first vaccine shot.
In Covaxin, after second month of second dose, the antibody level started decreasing. However, all till 6 months, all were positive, none of them become negative. And for Covishield, antibody level or titer started decreasing from the third month of complete dose.
Experts say waning antibodies doesn't mean that one is not protected at all.
As of now, I would say that because this was a sample size was healthcare worker, double vaccinated, and as the vaccination rate goes up, the risk of infection will also go down commensurately. But let us vaccinate double dose first, whatever has been planned by the government of India.
Meanwhile, a real-world study in the United Kingdom on more than 1 million people who got 2 doses of Pfizer or AstraZeneca vaccine showed reduced antibodies too. Even in the United States, studies suggest vaccine protection wanes among older populations. A recent review of data on boosters from the US FDA on effectiveness versus infection states that vaccine efficacy for Pfizer-BioNTech reduces by 6% every 2 months. In the UK study, the rate of protection after 2 shots of Pfizer-BioNTech decreased from 88% at 1 month to 74% at 5 to 6 months, a reduction of about 12% overall. For AstraZeneca, the fall was from 77% to 67% at 4 to 5 months. Moderna vaccine also shows waning of immunity, 36% fewer symptomatic breakthrough infections in an 8-month follow-up compared with 13 months. Experts feel that immunity against COVID is expected to wane, and COVID vaccines don't provide lifelong immunity like a measles vaccine. And that's not a reason to not get vaccinated.
For certain subsets of the population, especially the elderly, more so if they have high-risk medical conditions or immunocompromised individuals, healthcare workers on the front lines or those interfacing with immunocompromised individuals, their third dose may offer some benefit and should be considered.
Countries' health regulators are justifying the need for booster jabs. UK's expert advisory panel recommended a third booster dose to everyone over 50 years. Israel has begun the booster rollout. Vaccine makers are making a case with the US FDA reviewing research that a third shot can restore vaccine efficacy to 95% and considering recommending booster doses for all ages above 16 years, 6 months after the second dose.
The study done in India on waning antibodies will also help the Indian government and health experts decide whether there's a need for booster dose in the country and whether giving it to vulnerable or comorbid sections of the population will have any merits when these booster doses will be considered. With camera person Kirpan Singh in New Delhi, this is Milan Sharma for India.
As we see grave vaccine inequity, there is a big debate on whether booster doses of vaccines should be given. What is the data around it and which countries are giving it out and why? What is India really planning? Take a look. To give or not give? Is it ethical or not? Is it needed or not? Is it fair to give them? Is there data to show they work? The debate on giving out booster doses is a raging one. More so because immunity offered by vaccines wane, and that really is no secret. And also because there is shameful vaccine inequity the world is witnessing now. The World Health Organization has had to step in to say that at this point, boosters are not to be given, and the moratorium is for this year.
Today, I'm calling for an extension of the moratorium until at least the end of the year to enable every country to vaccinate at least 40% of its population.
Here is why the World Health Organization is giving a thumbs down to booster doses. Some countries have less than 2% vaccination coverage, most of them in Africa. Booster rollouts have already begun across the United States, where nearly 54% of the population is fully vaccinated. Medical experts world over say that inoculating populations world over is important because virus is going to be in circulation, and until and unless there is complete vaccination, it's also going to mutate further. That's the reason why it is important to think of complete vaccination first and then later on to think about boosters or third doses essentially. No one is safe until everyone is safe is what medical experts, including the World Health Organization, say. Experts also say that when 2 doses fail to generate an immune response in individuals who are immunocompromised, a third dose is warranted. The World Health Organization agrees, but several studies suggest that even in healthy individuals, vaccine-acquired immunity wanes, raising the obvious question on the need for boosters.
There may be some individuals who fail to mount a proper immune response, such as those who are immunosuppressed or those who are very old. In these individuals, it's speculated that giving a third dose might improve their immune response. As of today, there is no evidence that a fully vaccinated individual requires a third dose. If, on the other hand, in the future, evidence appears that protection against severe disease is dropping, yes, that may be a time to consider them, but not right now.
While developed countries like the United States, Germany, France and Israel, among others, are giving out booster doses, defying the advice by the World Health Organization, India is following the WHO advice on this to the T.
We do not really have true data that says that after a certain period of time, there is a need for a booster. It is not only to be based on antibodies. It is also to be based on the T cell response and the memory cells, because they will invoke the response. We assure you that the scientific journey to sort out the timing and the need for booster will continue. Even today, WHO doesn't have a definitive recommendation on boosters. So hold on.
A study published in The Lancet also says that the limited supply of these vaccines will save most lives if made available to people who are at appreciable risk of serious disease and have not yet received any vaccine. Even if some gain can ultimately be obtained from boosting, it will not outweigh the benefits of providing initial protection to the unvaccinated. In New Delhi, Sneha Murdani for India Today. Mixing of vaccines, well, that's happening world over already, but the next big thing in the fight against COVID-19 is the use of combination vaccines. Novavax, American pharmaceutical giant, and also Moderna are working on combination vaccines for COVID-19. We tell you all about them. A booster with a difference. Moderna is working on a shot that will have two benefits. A one-dose vaccine that will battle both COVID and influenza. Dual vaccines are not new. It's been commonly used for children to tackle measles, mumps and diphtheria, among other ailments. But one that also tackles COVID is a new experiment. A booster combination shot makes life a lot easier for people. This is how it works. 2 or more vaccines are put into one shot. So when your child next goes for inoculation, instead of 5 jabs, it will be maybe 2 or 3. In the long term, it also helps lower the stress on supplies and storage of vaccines.
For example, mRNA is known to have a significant increase in antibody levels. So therefore, using mRNA vaccines along with vector-based vaccines, if there is a combination that is available of such, then you have a wide range of benefit, including both B and T cell response.
There is still a way to go before the COVID flu booster arrives. Moderna is still conducting clinical trials to ensure the safety of the combination vaccine.
While the safety issues remain to be very optimistic as of now, which means not many adverse effects are reported so far. But the data that we have so far is also from very small studies.
When it does, it could be ideal, especially for children. Many believe that COVID-19 is here to stay, in which case a vaccine that works against coronavirus and the common influenza makes good sense. Bureau Report, India Today. Well, that's all we could pack in this edition of COVID 360. Until next time, be safe and you must get a shot against COVID-19 if you haven't already. Take care of yourself and thanks for being with us.